Hi class, today we're going to be talking about Chapter 5 in our text, Developmental Disabilities, Causes and Classifications. A lot of good stuff in this chapter. So once again, I want you to keep in mind the best strategies in order to retain the information. I'd like you to take a look at the objectives for each chapter as you begin. Think about what it is that you already know about the information before proceeding on to go through the content in the chapter. So for this chapter, Chapter 5, after reading this chapter, you will be able to specify several possible causes of developmental differences and give examples of causes both prior to and after birth. Describe and understand the classifications of developmental disability. So thinking about what you've already learned so far in this course and what you've brought in from your own experiences and prior knowledge, you probably have a lot of your own thoughts and ideas to address these objectives. So I want you to think about those for a minute. Remember the metaphor I discussed in Chapter 4. When you activate your prior knowledge, you're creating kind of these coat hooks in your brain. Thinking about a coat closet, for example. So we're activating those hooks. That's our schema. It's our prior knowledge. And then as you go through the chapter, you'll be able to hang different items, and that's the new information. And hopefully by doing that, you will be able to move this information from your short-term memory into your working memory and long-term memory. And you'll be able to retrieve this information when you need to. The textbook talks about a variety of different causes for developmental differences, and they divide it into a few different categories. So the first are biological factors. One of those could be considered biological insult, which refers to interference with or damage to an individual's physical structure or functioning. And this may occur at the time of conception or during pregnancy, which would usually be within the first trimester and may be related to health problems in the mother. Genetic disorders result in abnormal biological development, may be caused by deviations in chromosomal structures or by abnormal single gene. So in my son's case, he has a genetic disorder which happened upon conception. So it was a genetic mutation. Neither my husband nor I are carriers of the IQSE2 gene mutation, but in my son, somehow it happened. So it was de novo, meaning it was new. It was a new mutation that occurred in him. Syndromes are groupings of similar physical characteristics known as stigmata, and we'll talk a little bit more about some examples. So syndromes are usually marked by physical characteristics, something that oftentimes parents or specialists or geneticists can determine by doing a physical examination of the child, which would maybe signify red flags to do further genetic testing to confirm based on those stigmata. One such developmental syndrome is Down syndrome, which is probably one of the more common ones. It's also known as trisomy 21 because the condition is caused by 3 number 21 chromosomes, which is usually contributed by the egg, though in some cases it's also it can be contributed by the sperm. So instead of having 46 chromosomes, which is 23 from the mother, 23 from the father, the child has an extra one, so a total of 47 chromosomes. So some of the stigmata for Down syndrome includes recognizable by a flat face, upturned eyes, small ears, short stature, and the simian crease. So you can see in the photo here that a normal crease, if you look at the palm of your hand, you would have 2 normal palm creases, but a simian crease would be 1 crease in the middle of your palm. So when my son, for example, before we had diagnosed him, I remember the geneticist doing a very, very specific genetic exam where we looked at the palms of his hands, he measured the ears, he measured how far apart the eyes were, and looked at his skin to see if he can find any determining markers or stigmata that would indicate a syndrome. Also with Down syndrome, heart and intestinal abnormalities are common as well. Another syndrome is Fragile X syndrome, which is caused by a break on the X chromosome present in males. So Fragile X syndrome is typically more common in males because girls have two X's. So typically if we have one defective X, then a normal X can kind of make up for it. But in males, because they only have one X and one Y, if the X is damaged, then we then see the developmental disabilities. It's characterized by large ears, language delays, autism-like behavior, hyperactivity, and delayed motor development. An estimated 5 to 7% of intellectual disabilities in males may be due to Fragile X syndrome. So that's a pretty high percentage caused by Fragile X. There are also metabolic disorders. These cause a breakdown somewhere in the complex chemical activities needed to metabolize food. And this breakdown can destroy, damage, or alter cells. Metabolic disorders are single gene defects such as PKU, phenylketonuria, which can result in brain damage if not detected early and treated early. So you'll notice now in hospitals, newborns, during the newborn screening, they will get, as you can see in the photo here, they will get their heel pricked to get the blood test to make sure that they are not showing any signs for PKU. So with PKU, for example, if a child does have PKU and they're ingesting milk from the mother, they're going to build up toxins because their body can't properly metabolize that milk. And therefore, if not treated quickly, the child can have brain damage. So it's a pretty severe condition if not detected early. So that's why we have the PKU test done in hospitals when children are newborn. And if you discover that a child does in fact have it, there are supplemental diets that the children can be on so that they won't have these adverse effects. Here's a diagram that goes into a little bit more detail about PKU. It is a recessive trait, and it's caused by the inability to break down aspartame. It's an amino acid found in many diet foods, diet drinks, and meats. Consuming these items can cause irreversible brain damage in someone who has PKU. So you can see in the photo, you can see some examples of items that are high in PKU and some examples that are low in PKU. Other causes of developmental differences, we have abnormal gene disorders. So this would be, for example, Tay-Sachs disease, which is an accumulation of fatty tissues around the brain that eventually leads to death. Also, cystic fibrosis, it's a buildup of mucus in the lungs, which makes it difficult to breathe. There have been breakthrough medical treatments that are now helping these individuals live longer and more productive lives, because in the past, cystic fibrosis would be fatal because the child is not able to breathe or the adult is not able to breathe and function. But now they have a lot of advances, like there are compression vests that someone with cystic fibrosis can wear. It's a vest that is plugged into a generator and it vibrates vigorously and can help break up the mucus. Another abnormal gene disorder would be sickle cell anemia. That's when the red blood cells are not formed correctly, making it difficult to navigate the bloodstream. It is often accompanied by joint pain and ulcers. We also have Duchenne muscular dystrophy, which is typically present in males, and the symptom would be the muscles deteriorate. There are also prenatal infections and intoxicants. So one would be rubella, which leads to devastating lifelong and severe disabilities. The CMV virus. In this particular situation, the children will appear normal at birth, but then later in life, they develop intellectual disabilities, deafness, and diseases in the eye. We also have herpes simplex, which is inflammation of the brain and spinal cord. And even in remission, a mother can pass herpes simplex onto her child during the childbirthing process. And continued AIDS can be passed to the unborn child through the birth canal or breast milk and leaves a child's immune system helpless to fight off disease. Also, maternal diabetes. A lot of mothers are screened for gestational diabetes because we are at high risk for problems in children. So it's important for mothers to get screened so that doctors can help give the mother a special diet, and so that way the the gestational diabetes can be monitored and managed during pregnancy. Also, there's preeclampsia or toxemia. Usually occurs after 20 weeks of pregnancy, so after the mom's about halfway through the gestational period. It's characterized by high blood pressure and excess protein in the urine, and complications can lead to death in both the mother and the infant. So preeclampsia can be quite serious. Other prenatal infections and intoxicants. Alcohol and other drugs have been proven to lead to birth defects such as fetal alcohol syndrome and fetal alcohol effect. Poor nutrition, including a lack of protein, can lead to low birth weight, illness, and higher risk of death in the first year of an infant's life. Poor nutrition can also damage the developing brain and nervous system. So think about all of the characteristics of these disorders and syndromes when you do your Parenting an Exceptional Child project. You can get some ideas here on what you might include in your project. There can also be complications that occur during birth. So for example, lack of oxygen to the brain, anoxia can occur as a result. Premature babies may suffer hemorrhaging. C-sections may need to be performed if the life of the mother or the infant is in danger. So again, in the beginning of this chapter, the text talks about how different developmental issues can occur before birth, during pregnancy, during birth, actually during labor, and then after birth. So things that can happen from environmental factors. So again, complications following birth can include meningitis, which is a virus or bacterial infection that causes inflammation of the protective covering of the brain and the spinal cord and can lead to brain damage. My husband, for example, had meningitis as a child around 18 months. And one of his side effects is that he has hearing loss in one ear. And that's from meningitis as a toddler, basically. There's also encephalitis. Swelling of the brain can lead to brain damage. So encephalitis would be fluid in the brain. And lead poisoning. Poisoning from lead found in lead-based paint in older homes can damage nervous system. And so that often can be more prevalent in low-income areas or in areas that are not regulated because the lead-based paint was allowed in homes that were built a long time ago, and also that lead can also be found in the soil around the home. So if you have children who are playing in the soil, or anything growing in that soil can also be contaminated with the lead, so it can be pretty serious. So poverty being one of the main environmental factors that can cause difficulties in children's development. So one would be nutritional deficiency. Children living in poverty tend to have inadequate nutrition. And I just think about, being somebody who's middle class relatively, and I think of how expensive it is to eat healthy. If you think about to eat healthy, you would have to go to the store quite frequently to get fresh produce. And thinking about how much that costs, and the more preservatives foods have, the longer they last. So in order to have fresh fruit all of the time, food that's low in preservatives, you're constantly going to the store. And if you think about neighborhoods that have the more fast food restaurants tend to be the lower income neighborhoods. And just thinking about, as a working family, the convenience of just being able to go right out and grab food, and how that, is not giving you and your family the best nutrition, but it's the most convenient, it's the most cost effective. And so it's really a difficult cycle when you think about how nutrition is really, really tied to socioeconomic status. WIC was designed to eliminate some of the counter effects of poverty. WIC provides funds to pregnant mothers and then their newborns to purchase healthy foods. So there are programs like WIC in place to help ensure that children who live in low-income neighborhoods can be given a better chance with more nutritious foods. Another environmental factor is inadequate health care and education. Living in poverty, many women do not seek out prenatal care, leaving themselves open for premature labor and other complications. So think about it again in terms of the cycle. So if you have women who are living in poverty, they're less likely to seek out prenatal care, probably because they don't have health coverage. They're not able to seek it out. Maybe they're not even aware of what sorts of resources are available. And then, of course, without getting that prenatal care, the mother is potentially vulnerable for later complications, both of her own health and her unborn child. Regular medical checkups are also good for the newborn child. And again, that takes time. That could potentially cost money if the mother doesn't have any sort of health insurance, and so that's difficult. Without health insurance, good care is not always possible. Well, hopefully those challenges are changing for the better now. Homelessness and substandard housing can also be factors. Living in these conditions can cause health problems by being exposed to contaminants in the environment. So thinking about smog, the lead issue again, and other airborne toxins. Single parent families, single mothers in particular, tend to work multiple jobs, leaving their children unattended or with little supervision. So unable to supervise diet and nutrition, exercise, any health issues that may occur because the mother's trying to earn a living, or the father or whoever the caregiver is out of the home to be able to provide for the family. Childcare is another important factor. Quality childcare can combat the effects of poverty, but oftentimes people in poverty cannot afford quality childcare. Centers need to offer the best with what they have, making quality available to all. And that's why programs such as Head Start and Early Head Start are really, really important for families who may not be able to afford quality healthcare for their children otherwise. So now we're going to talk a little bit about classifications of developmental disabilities. Categories of disabilities under IDEA, which again is the Individuals with Disabilities Education Act. There are specific learning disabilities, for example, a disorder in one or more of the basic psychological processes involved in using language, spoken or written. Speech and language disorders, which can include difficulty with receptive or expressive language. So receptive language would include being able to understand words that are spoken to you, and expressive language would be able to orally, verbally communicate for wants and needs. Developmental delays would include a delay in one or more of the developmental domains. So for example, intellectual, physical, cognitive, etc. Intellectual disabilities would include sub-average general intellectual functioning along with deficits in adaptive behavior. Emotional disturbance would include behavioral or emotional responses that are different from age, ethnic, or community norms. So that's an important thing to consider, because what might be considered normal and appropriate in one age group, ethnicity, or community might differ from another. So that context needs to be considered before we would conclude that a child has an emotional disturbance. Multiple disabilities would include a child or an adult who has a combination of one or more disabilities occurring simultaneously. Hearing impairment and deafness. Hearing impairment is a hearing loss that adversely affects educational performance. Deafness is a hearing loss that is so severe that individuals cannot process spoken language even with hearing aids or other forms of amplification. So if you wondered what the differences were between hearing impairment and deafness, you can see that on a continuum, deafness would be much more severe, that even with assistance of hearing aids or other forms of amplification, the individuals cannot process spoken language. There's also orthopedic impairments where developmental problems interfere with walking and other body movements. Other health impairments might include limited strength, vitality, and alertness. So here you see my son Colson. This is at Napa Center getting some therapy. He has ankle braces, which are called AFOs, ankle foot orthosis or orthotics. And he would be an example of an orthopedic impairment. So he is non-ambulatory. He is unable to walk. So in this particular therapy, they are working with him being able to sit up and head control and bearing weight. Another classification of developmental disabilities would include visual impairment. So this would be a range from partially sighted to blind. Individuals who are partially sighted read large print or possibly regular print. Individuals who are blind have a severe enough vision loss that they cannot read print. Combined deafness and blindness would be a child who has both a loss of vision and hearing. The book doesn't really talk much about CVI or cortical vision impairment, which is a diagnosis that my son has. So I just wanted to include a couple of pictures. As you can see, with cortical vision impairment, it's interesting because that's a disorder where the eye physiologically is fine and it's intact, but because there are developmental delays, the brain is not processing properly what it's seeing, what it's taking in. So one way to help children with CVI to be able to see, there has to be a high contrast. Either things are illuminated, like you can see the picture with the little girl, and the illuminated grid with the colors, or things have to be on a black background, and the colors that stand out would be reds and greens and yellows mostly. So, for example, for my son Colson, we have found some great books that help with his CVI because the background, the pages are black, and then the images are brightly colored. Or in speech therapy, for example, the speech therapist would make the accommodation of putting up a black sheet against the wall, shining a light, and then using, whether it's felt figures or puppets, to read a book, for example, to read a story like Brown Bear. And so the lights are dark, there's the black background, and then the animals or the figures are illuminated and bright. And so you'll notice that my son will be able to follow those features, whereas if we had a regular book with bright light, with normal light, his eyes are not able to focus on those objects and process it because of the cortical vision impairment. Autism is a developmental disability significantly affecting verbal and nonverbal communication and social interaction. Traumatic brain injury. This category of injuries, either open or closed wound to the head, causing tearing of the nerve fibers, bruising of the brain against the skull, or bruising of the brain stem. Here's an image that goes into a little bit more detail about traumatic brain injuries. So I'll give you a moment to take a look at some facts about traumatic brain injury. So here's a final thought on categories. Each category describes a condition that makes a student eligible for a free and appropriate public education. So that's the FAPE law, FAPE, F-A-P-E. To meet the definition, a child's educational performance must be adversely affected by the disability. So in order to be qualified under FAPE, whatever the disability that the child has, it must adversely impact their educational performance. The category does not prescribe the services for a child, but a program should be planned based on individual needs. So these are important things to keep in mind, especially if you are a caregiver of a child who is being diagnosed, or if you are a teacher of a child. It's important for you to know your rights and to know what is legally bound or should be given to that child by law. So let's go back to the objectives that we looked at the beginning of the chapter. See how much more new information you have acquired to add on to those coat hooks. So again, the first thing that you would be able to do after reading chapter 5, specify several possible causes of developmental differences and give examples of causes both prior to, and after birth. Describe and understand the classifications of developmental disabilities. So hopefully after having reviewed your text and reviewing the PowerPoint, you would be able to then add to the knowledge that you originally had and be able to expand your knowledge on these objectives. Thank you.